Hi everyone, my name is Alison Kucharski. I am Feeding Northeast Florida's dietetic intern. I've been here since the beginning of July of 2019. One of the things I've been working on during my time here is a bit of a presentation for agencies and clients. We're working to explain how food can be used as medicine and really how to shop your pantry based on what you're getting from your pantry. So we're going to talk about how to prevent, manage, and fight some big 3 diseases with food. So after doing some research about Duval County and what the clients within these counties, what their health looks like, what diseases they may suffer from, I came upon some data that showed that hypertension, diabetes, and cancer are 3 of the biggest diseases that are really prevalent in those areas. In general, I have some data on MyPlate, which is the USDA's tool to teach the country about eating healthy. MyPlate is a great visual breakdown. You can see it right up here. It explains how fruits, vegetables, grains, protein, and dairy all should be on every plate that you eat throughout the day. So if you're eating 3 meals a day, you'll try and have these 5 food groups at each of those 3 meals. One of the biggest points to take away from MyPlate is filling half of your plate with fruits and vegetables. These items can be canned, frozen, fresh, or even dehydrated. A great option with canned foods, if you're getting those from your pantry, is to rinse them out with water to lower the sodium content. For the grains portion of MyPlate, you want to really try and make half of your grains whole grains. Some great options I have some out on the table are brown rice and even cereal that's made with whole grains. Really one of the biggest things that MyPlate emphasizes is that just general variety and a great balance within each of your meals. We want to incorporate lean sources of protein like chicken, turkey, seafood, and really kind of lower our consumption of red meat. Protein sources can also be plant-based like beans, eggs, peas, and so on. As far as dairy, another great source of protein, but really some great options for dairy are yogurt, different types of milk, even ice cream. No food is good or bad, all foods are good. They all provide us with calories, which is essentially energy. So think about your body like a car. You are fueling your body with calories just like you would fuel your car with gas. Really simple concept, and overall food should be enjoyable and easy. It shouldn't be a challenging subject. I have some more info on here about how much of each food you should eat throughout the day based on your gender as well as your age. I know it's a little bit hard to see, but this poster board will be around for you to view later too. So as far as the diseases that I mentioned before, we'll chat a little bit about diabetes, which is typically called diabetes mellitus. As most people know, there are 2 types of diabetes, type 1 and type 2. Type 1 is typically where your immune system actually attacks your insulin-producing cells. Type 2 is that your cells become resistant to insulin. Type 1 diabetes is typically diagnosed earlier in life. Typically it was actually used to be called child diabetes. Type 2 is, like I said, diagnosed later in life, and it can actually be called adult onset. But within our current day society, these can both be diagnosed at any point in your life, so just be on the lookout. Some risk factors include family history, environmental exposure, race, age, gestational diabetes incidence, weight, physical activity, and family history. So all of these can play a role for both type 1 and type 2. Some symptoms of diabetes, again, you'll be diagnosed by your doctor if you do have diabetes, but some things to look out for if you're unsure are increased thirst, frequent urination, extreme hunger, unexplained weight loss, and a few other things. For treatment of diabetes, we really want to focus on a balanced diet. So again, there's no specific diet for diabetes or any of these conditions, but there are some key things to focus on. So one of the biggest things with diabetes is something called consistent carbohydrates. So this is keeping your blood sugar at a steady rate and level throughout the entire day. One of the biggest arguments within diabetes is I can't have carbs, carbs are bad, it's sugar, and that's completely false. You just really need to be mindful of your carbohydrate intake and be aware about keeping that carbohydrate intake steady throughout the day. So a great way to do this is to make your carbohydrate that you consume throughout the day. Keep the grams that you consume similar through your breakfast, lunch, and dinner. Keep all three of those consistent, and then choose an amount for your snacks in between breakfast and lunch and dinner. This will prevent your blood sugar from spiking, and it'll really keep your diabetes under control. Again, whole grains are huge within diabetes, as with all of these diseases and just general health and wellness. Whole fruits and vegetables, really filling that plate with lots of fresh veggies is a great option. And looking for lean sources of protein. Some great options for grains, like I said, are brown rice, quinoa, barley. Just kind of think outside the box to make cooking these fun. As far as diabetes, we really want to also make sure that we are baking and broiling items, roasting them. Anything but frying really is one of the biggest things we want to focus on for diabetes. So yeah, that's some great tips about diabetes. We'll switch on over to hypertension. So when we talk about hypertension, this is known as high blood pressure. Again, this is something that's diagnosed by your doctor and can actually be diagnosed with just a simple reading really quick. So your doctor or nurse would put a blood pressure cuff on you, and if your reading was higher than 140/90, that would indicate high blood pressure. There are also ways to diagnose pre-hypertension, so it kind of means that you're at risk for high blood pressure. So you just want to be more mindful and make some dietary or lifestyle choices that can lower your risk and lower your incidence of high blood pressure. So a fun little fact is that hypertension is actually the most common form of cardiovascular disease in the entire world, and 1 in 4 Americans have this. So you or someone you know is most likely a sufferer of hypertension. You may not always have symptoms. Sometimes it just pops up out of nowhere. So it's really important to be mindful of your choices and pay attention to how your body feels. So some treatment for hypertension, one of the biggest ones is nutrition therapy. Obviously we want to use food to fight disease rather than taking some form of medication. It's typically a cheaper route and it's overall better for you. So using the DASH diet is one of the best options for hypertension. Again, like I said, there's no one specific diet and there are no good or bad foods. So you shouldn't feel like you're limiting or restricting yourself. But the DASH diet is just a great approach to try and manage this disease. So DASH stands for Dietary Approaches to Stop Hypertension. It's very similar to the Mediterranean diet. So really good fats, lots of fish, whole grains. All of these are great options that are lifelong approaches to reduce the sodium content in your diet and also reduce your blood pressure. So some lifestyle changes as well include stopping smoking. It's a huge one with blood pressure. You also want to increase your physical activity with anything. Physical activity can really help eliminate symptoms if you do have them. On top of that, physical activity will help lower your blood pressure naturally. So also you want to work on decreasing your alcohol intake, as alcohol can increase your blood pressure. Consume less sodium, and even sometimes weight loss can help. Medications are also another option to manage this disease if you've tried the other options and they haven't worked for you, but really we're going to focus on the DASH diet and how that may help you. So the DASH diet, like I said, has a really big emphasis on fish, fruits and vegetables, low-fat dairy, whole grains, poultry, and nuts. So how much of each should you be consuming? You should shoot for 6 to 8 servings of grains, and again focus on half of those being whole grains because they have more fiber. They'll keep you fuller longer, and again work to lower your blood pressure. You should aim to have 4 to 5 servings per day of vegetables. Try and make your plate colorful. Have carrots, tomatoes, broccoli, spinach, all types of veggies. For fruits, similar to veggies, it's 4 to 5 servings per day is your goal. Things like apples, melon, berries. Use what's in season and use what's at your pantry. It'll be the cheapest route, and a lot of times you can find some great options at a local farmer's market as well. For dairy, you should want to shoot for 2 to 3 servings of dairy per day. This can include milk, yogurt, cheese, even low-fat options if you're being mindful of your weight as well. One of my favorite choices for dairy is actually Greek yogurt. It's one of my favorite breakfast or snack options. You can pile some whole grain granola on, you can throw some fruit on, you could even throw it in a smoothie and add some greens to it to really get a full almost meal. So lean protein is another thing we want to focus on here. And you want to look to have 6 1-ounce servings of protein per day. So this is, like I said, lean meat, fish, poultry, eggs, Even beans, nuts, they can all serve as protein sources. Nuts, seeds, and legumes, like I just mentioned, legumes, beans, these are all really good sources of fat and really good sources of protein and fiber. 4 to 5 servings of those per day. And you can throw things like almonds, sunflower seeds, peas, lentils on a salad or as a side dish, even as a snack throughout the day. The last thing we want to focus on with the DASH diet are fats and oils. So we want to aim to have 2 to 3 servings of these, and we want to look for those good fats. Things like olive oil, avocado, mayonnaise, salad dressings even. Just being mindful of how much we're pouring on and maybe using a measuring cup for this. Some hypertension pantry tips. We want to look for things that have low sodium or low salt on them. So one of my favorite snacks is whole cashews, and these are lightly salted. You can find these in any grocery store or even in your pantry. They make a great snack option, and as long as you're looking at the serving size and see about how much is in a serving size, it's a great option to really be mindful of your sodium. Another great option is using reduced sodium broth when you're cooking, let's say, your brown rice or any of your other meal items. Using a lower sodium broth or even soup is a great option to just be more mindful of that. We should also look for low salt spices. So a great brand, one of my favorites, is Mrs. Dash. If you can't find this in your store or want to have something that's a little more shelf stable as well, using fresh garlic or even garlic powder, onion powder, parsley, basil, cumin, paprika, any of these spices can really season your food without using salt. It's a great option. So again, we don't want to add salt to when we're cooking pasta or rice, but you maybe use a broth instead to still get flavor without raising the sodium content. One of the last things that I did mention before was rinsing those canned items to really lower the salt content. Canned items are great, both fruits, veggies, to really be shelf stable. You'll always find them in your pantry, but lowering the sodium content is the main goal here. The last disease we'll talk about is cancer, which is a little bit of a tougher topic. It's affected most of our families in some way or another, whether it's not you personally, you know someone that has suffered from this. Essentially, cancer is a disease that just really has abnormal cells dividing uncontrollably and spreading throughout the body. It's the second leading cause of death in the world, but we're really working to improve our screening techniques and be able to narrow down our treatment and really see what works best. There's tons of research still being done, but we know that following a healthy, balanced diet can also help avoid cancer incidents in your life. So for nutrition during and after treatment, we want to focus on, during treatment, small, frequent meals, things that are easy to chew, easy to digest, and easy to swallow. Things like oatmeal, soup, applesauce, yogurt are all higher calorie options that'll just be a little bit more simpler for your body to take in. You also want to be mindful about your hydration here. So really focus on drinking lots of water, lots of items with electrolytes, whether it's Gatorade or Pedialyte, to just keep your body functioning properly. After cancer treatment, our focus will be on fruits and vegetables, just like every other disease. And even just for those who are healthy individuals. Fruits and veggies are always our main focus. Whole foods are crucial, but filling your plate with fruits and veggies will really heal your body from the inside out. Other tips for prevention, simple things. Stop smoking, avoid excess sunlight, things that really don't have to do with your diet, but all contribute to really preventing cancer in your life. So you can look for these nudges and these nutrition choices throughout your pantry. Whether you already have it in your pantry or you're shopping from one of the agencies. But really, big things to take home: make half your plate fruits and veggies, make half of your grains whole grains, and really focus on good hydration, water, and 100% juices as your option. So yeah, thank you so much for listening and have a great day.